Good evening and a very warm welcome. Many thanks for joining us on this 10th day of December. Starting us off tonight, a study by the National Commission for Human Rights praises Rwanda's response to the COVID-19 pandemic and respect to human rights. These remarks were made on Thursday during the celebrations of the 72nd anniversary of the Universal Declaration of Human Rights. Fiona Mbabazi starts us off tonight with this story.
The Human Rights Survey was conducted from March to October this year in 15 districts across the country. The Commission's chairperson, Mkansine Marie-Claire, explains that various agencies must continue to adhere to the same rope so that even problems can be resolved in the case there are violation of the COVID-19 prevention guidelines. What we ask from the government, firstly, is for them to explain to the citizens how these decisions are made, because when they understand, then it becomes easy for them to implement. The results of the study also show that the government's measures were aimed at protecting people's lives, although some did not immediately respond favorably. The international community and civil society organizations based on this report also appreciated the way Rwanda continued to put in efforts in the fight against COVID-19 while respecting human rights.
The government has taken some action. First, the rights to health. Rwanda is commended as being a very good example globally in fighting this pandemic. And kudos to health workers and all the actors in that field. The second, the rights to life, as this pandemic has claimed some life, and unfortunately with COVID-19, but at the same time finding the right way to strike the balance between making sure that we have 100% compliance, but at the same time catering for human rights.
The government has done its best at a level of 95%. However, a lot needs to be done to pull in the 5%, but we can all collaborate to achieve this. Justice Minister Johnston Busingye says the manner in which the pandemic affected the implementation of preventive measures was in line with the law.
We all know that until now, with no vaccine yet, no drugs yet, so life was a bit precarious, even for law enforcement. So for there to be a few things that made the public uncomfortable and rose up and demanded that we review things, I think was legitimate, as the action of law enforcement was legitimate. And spread of the virus, thereby laying a quick foundation for quick and sustainable recovery, protection of lives, and preservation of human rights.
The National Human Rights Commission say they are pleased with the progress they have made in fulfilling their responsibilities related to the promotion and protection of human rights.
Rwanda aims to have a health post in every cell by 2024 so that residents are able to access healthcare services and avoid cases of people getting critically ill from their homes. The Ministry of Health says these health posts should be functioning well and self-sustaining. A cross-section of residents say that health posts through health counsellors and health centres have helped them access medical services easily. Anytime you're sick, they are available to give you medical assistance regardless of whether you are an adult or a child. They welcome you and give you the services you desire and advise you accordingly, which prevents one from becoming very ill from home. We are glad we have this health post close to us. We are able to get emergency health care. For example, we as drivers, it's possible to get involved in an accident and they bring us here. Some of those that work in these health posts acknowledge that there are various services offered to residents in these health posts. We examine both adults and children. We offer wound treatment and care. Our lab screens for HIV and other diseases. We offer vaccinations too and monitor and follow up children suffering from malnutrition. We are able to help pregnant mothers check the heartbeat of their child, check if the cervix is in the right shape, and we are able to check for blood pressure and other tests a pregnant mother requires before childbirth. The Ministry of Health says that they have requested for new buildings to be constructed so that these health posts are able to operate. Some people will also be required to donate their houses, while other health posts will be built by donors and the private sector. The Minister of Health, Dr. Daniel Ngamije, says that while it is a developing sector, these health posts should put in effort to provide good services to the residents who seek health care from them.
Ibyo byose turabikora kugira ngo twongere twegereza abaturage ibikorwa by'ubuzima.
We are doing all this to bring healthcare closer to the people, for them to get a health post near them and get basic medical care. And if they get more ill, they be taken to the health centers. In general, they are working. Where there are a few challenges, such as the workers not being consistent due to the business not being profitable sometimes, we team them up with a health center near them to support them. Last year's National Dialogue Council concluded that there is need to improve on the functionality of health posts so that all facilities are functioning properly, and where necessary, the services provided are expanded to better serve those who need them. The Health Minister, Dr. Daniel Ngamije, says this will help save lives and will be a source of income. The plan is for them to work well and be self-sustaining, have their own employees and make profit as well. We want them to be available in every cell and to be able to have proper service delivery. We also want them to increase the services they provide. They had few services, but there's much more they could do, such as examining pregnant mothers for malaria, hepatitis, HIV, among others, as well as testing all the people that seek these services, those that are sick to be given treatment, and if they are very sick, they are to be transferred to a nearby health center. If all the cells are to have health posts, it means 2,148 will have to be built by 2024. However, figures from the Ministry of Health show that there are 1,117 health posts in Rwanda, with 480 being private and 8 being in the second tier. Currently, 927 health posts are operating, while 190 are not. 59 were suspended by RSSB for fraud. In 2019 and 2020, 209 health posts were built, and today Rwanda has 509 health centers and 58,000 health counselors in Rwanda. Now, still in the health sector, a lot has been happening in the COVID-19 world, with the latest being the Pfizer BioNTech vaccine being rolled out in the UK. This has been viewed as a remarkable step in the fight against the pandemic, and earlier we spoke to Dr. Daniel Ngamije about this vaccine and where Rwanda stands in acquiring it. Well, usually vaccines take longer to develop, and this has been done in under a year. How big of a step is this, and can we say that this is now the beginning of the end of the pandemic?
This is a good achievement, and it's really unusual achievement because to produce a new vaccine, it takes normally around 3 to 5 years for having a vaccine in market. What happened with COVID-19 vaccine, it's really amazing for having the vaccine for in less than 1 year. The Pfizer one and also others that are in process to be certified soon. So is it the end of the pandemic? It's a good step. We still have time to cross-check and see what will be the impact of having this vaccine available, because we don't yet we are not aware of how long the immune system will last. Definitely, it will require some additional math so that we can know whether a vaccinated person is protected for 2 years, 3 years. I don't know. So we can't say the end, but it's a good step for sure.
Absolutely. And with the rollout of the vaccine in the UK, how is it going to impact, or how is it already impacting the actions of other governments? And in particular, let's bring it home, Rwanda.
I think the impact of it is that for now we know that there is a vaccine. there are at least 3 vaccines that are available, and through COVAX facility, getting our vaccine around, getting these vaccines. And we are, in the meantime, preparing ourselves to receive those vaccines, depending which one will be available, with which technical requirements. We are working on different scenarios for being ready at the time of vaccine are ready for us.
And in terms of the obstacles in the path of people accessing the vaccine, one of the vaccine that's actually already being rolled out, the Pfizer, we know that it is supposed to be stored under very ultra-low temperatures. How is this going to be done? Should we be having the Pfizer vaccine?
Yeah, we might have some quantities of that one, and central level we are able to store it. It requires ultra cold chain, minus 70 degrees and above degrees, Celsius degrees. We can receive it, a certain quantity of it, because after getting it from the central cold chain, you can still have like 5 days to use it using normal fridge for doing vaccine. But at the large extent, I think it might require a lot of capacities in terms of cold chain that we should normally procure and deploy in our health facilities. But as we have other alternatives, we have 2 vaccines that are not requiring extreme cold facilities for storing this vaccine, like the one Moderna, AstraZeneca. The vaccine we are using today for the rest of antigen that we are giving in our immunization calendar, we can use those fridge to receive and distribute without any additional requirement in terms of investment. So I think we'll see what kind of vaccine COVAX facility will deploy to us, and therefore be able to receive and distribute.
Absolutely.
Yeah.
And there's been a lot of controversies around the vaccine. Do you anticipate a problem of vaccine hesitancy? How much of an obstacle can that be in Rwanda?
Normally, our people are generally, they have a good rate of acceptance for regarding vaccine, because they know that the vaccine it's protecting, and they have confidence in their government that we can't allow any fake vaccine to enter in the country. We'll only use vaccine that are WHO certified. Means that we don't expect people to refuse the vaccine, and we'll of course we'll proceed with the awareness campaign to explain how is the vaccine, how it works, any side effect if there is anyone. We don't have anything to hide, so we believe that the acceptance rate on our side will be good.
Let's talk affordability. When the vaccine eventually reaches Rwanda, how affordable will it be, and who will be the priority for the vaccine?
The vaccine will be given at free charge. No one will pay, at least starting to the vulnerable group for which the vaccine is already subsidized. We'll start with health personnel, health providers, because they are part of people at high risk of being infected and infect patients as well. Aged people, elders, 65 and above, and people having comorbidities, so because they are at high risk of being infected and also risk of die. So these are 3 groups that are priority for getting the vaccine at 0 cost. And then the government is mobilizing resources for increasing the coverage from 20% to 60%, so that a good number of people can be vaccinated, because to stop transmission of vaccine in a country, at least we need to be around 60% and above to ensure that there is no transmission across the population. So we believe that this is our target, and we need to work on resource mobilization for making sure that we reach that coverage.
Okay.
Yeah.
And maybe to tackle a bit on what you mentioned earlier about how long the immunity from the vaccines may last. Do we know how long that will be? And also, does the vaccine actually protect from transmission?
Exactly. The vaccine is supposed to generate the immune system so that you can't be infected as you are vaccinated. If you can't be infected, means you can't also infect others. So the question is, for how long you will be protected for not being infected by any person you met with virus, and especially with that stage of infectiosity which is high, especially between the 3rd and 7th days from the incubation of the virus. So the question we should really, even researchers are still working on that, because the vaccine is just there, less than a month since it's declared meeting standards of efficacy and being safety. So the rest we'll monitor through different mechanisms, WHO and the rest of international institutions which are capable to monitor the efficacy of vaccine, including ourselves. We'll see how much among people who have been vaccinated. We can do a kind of cohort study and see among them who will be declared infected by the virus, although he was vaccinated.
Absolutely. Thank you so much, Dr.
You're
Daniel.
welcome. Yeah.
Well, we do apologize for the technical glitch during the interview. If I might paraphrase where the voice was cutting off, Dr. Daniel was saying that the earliest Rwanda will receive the vaccine will be March next year, considering all the logistics. Now, in other news, some school principals are urging the government to help them find a solution for them to get access to gas and get rid of the old system of using firewood and its related problems, like the high prices of firewood. Innocent Mugabo reports.
At the Romera Protestant School, there are 2,300 students, including 1,100 that have their lunch at school. The meal is prepared using firewood. The director of the school, Murichiumuchiza Edward, and Tumukunde Monica, who runs Efotech, say that wood is expensive compared to other necessities for the students to have a meal. We cook using firewood, as you can see. We measure it at a Daihatsu rate and use it for at least half a month, and each costs us 120,000 Rwandan francs. So that means that firewood costs us 240,000 Rwandan francs per month. Those who bring us this firewood come from far, which also makes it costly. For us, we spend 600,000 Rwandan francs for firewood every month. However, there are also some schools that feed their students using gas. When you reach their kitchens, work is done with a lot of hygiene, differently compared to where they still use firewood. Some school officials say that they also wish to switch to gas that does not pollute the environment. They're asking the government to help them get gas or other means that they will be able to pay in installments. It is not about the filling of the gas, but its installations. That is the most difficult part of this. Installing all of them at the same time is very difficult. We think in case the government agrees to negotiate with the partners and make it easier for us to pay for the gas gradually, it would be a very nice thing, and it would also be made easier for us. The Ministry of Education says that the Rwanda Polytechnic College is into studies on how to help these schools. Alan Rwumukarago, the Director of Research in IPRC Kigali, indicates the status of the program. The saucepans we need to make are about 6,199, including 30, which will be using gas that will be given to 30 schools. That is to say, one school in every district. 6,199 will be using briquette charcoal, because we can't all give them those of gas at the same time because it is expensive. With gas, there are two parts, where the first part involves the installation and the saucepans. What we will buy is only the cooking gas. The rest concerning the refilling will be done by the schools. Figures provided by the Rwanda Utilities Regulatory Authority RURA shows that in 2014, the amount of gas imported into the country increased from 4,240,080 tons to 21,517,960 tons in 2019. So far, 30.4% of Rwanda is covered by forests, with 79.9% of Rwandans still using firewood and 17.4% using charcoal. This means there is a need to increase the search for other alternative cooking means that do not destroy the environment. Innocent Mugabo, RTV News.
Residents of Kigali City say the fact that they lag behind when it comes to family planning is because there are some people who still have perceptions about it based on religious affiliations, as well as people being busy with life that doesn't give them time to family planning, citing inadequate awareness.
A cross-section of parents we found in Kigali seeking for family planning services believes this enables them have planned to have children they can take care of and helps them in terms of development. I decided to only give birth to those I can raise because family planning helps me have children that I can take care of. I came for family planning services because I want my child to have a good life and enable me find a better life for them. On the other hand, there are those who say that non-participation in family planning depends on perceptions and beliefs. If I have the ability to have 2 children, I will give birth to 2, and the others will also give birth to those they can take care of, depending on one's capability. Some healthcare practitioners say that despite the fact that some people are participating in family planning in Kigali, there is still a long way to go. They believe youth should know the importance of family planning before starting families. We explain to parents when they come and they make their own decisions. The challenge they put forth is that they don't have insurance, and we advocate for them, and for the rest we educate them about family planning. The 2019-2020 survey showed that the districts of Kigali City are in the last position in the participation of these family planning programs compared to the rural areas. The Minister of Health, Dr. Daniel Ngamija, says the fact that Kigali City comes last in these services depends on one's perceptions, but that more needs to be done. The districts that did not perform well, including districts in Kigali, were caught up with other things, and we want to expand on where these family planning services are given, just like in other health centers. We want to expand these services to pharmacies so people can access them there, because these are the same people that work in the health centers, as well as in the hospital, so that anytime you want the services, you can get them, because these people have the capacity to do so. So we are planning to expand these services where they are not, so that the number of people that seek them can increase. The 6th Rwanda Demographic and Health Survey shows that nationwide family planning, but the districts of Kigali are below 50%, where Gasabo is in the 26th position, Nyarugenje 28th, and Kichuchiro in the 29th.
Thank you, Innocent. Now, while the need for building materials made out of clay, i.e. bricks and roof tiles, is increasing, those that manufacture them explain that there is need for them to work in a modern way to satisfy the market and thus lower the prices of these products. Some manufacturers of building materials from clay say that they use traditional methods of making bricks in brick kilns, which doesn't satisfy the domestic market, hence causing an increase in the price as it takes a longer time for these bricks to be made available. These manufacturers say that finding machines that will help manufacture the bricks in big numbers at once will go a long way in their productivity. Most times where people have the machines, they have an advantage over us because they have high quality bricks. So having the machines would also help us get good quality bricks and in a timely manner. The fact that many of these manufacturers are not in cooperatives is also another challenge, as their energies are divided, thus getting modern equipment also becomes a challenge. Dr. Christia Sekomo Birame, the director of the National Industrial Research and Development Agency, emphasizes that through the Open Calls program, some will be funded, and this will help them increase their investment. Even when you give them technical support, they should be able to have enough labor. So that's among the things we are considering. Someone should have at least 5 employees and must have experience of about 2 years. So those that will have fulfilled these conditions, we shall support them, because we don't want to give the machines and they don't have where to put them. To date, More than 400 manufacturers who use clay to get construction materials have been visited, of which 61% are not in cooperatives and 81% have no protective equipment, while more than 50% employ between 1 to 10 people. Industry-related agencies insist that the sector is worth investing in because labor is cheap. No research has been done to determine the amount of clay below the surface of Rwandan soil. However, material from clay has been in use for many years. Now away from Kigali, Southern Province authorities say more awareness needs to be created on environment protection and strict laws enacted to protect it. This was announced in Kamonyi district during a joint operation by the National Police while planting of trees in Kanyinya Forest in Rukoma sector. Jade Umngari now reports.
Citizens of Remera Cell residing on Kanyinya Hill say there used to be a beautiful forest, but now everyone only sees the bare land. The area has been vastly damaged over the years by human activity and deforestation. At times they would tend to the area and other times they would not. They would cut down the plantations and leave the area as it is. They would not return to tend to it. On 10th December, the Rwanda police together with the residents of Rukoma sector planted 5,000 eucalyptus and pine trees. The residents of Kanyinya say they have hope the hill will come back to life. The trees planted will help a lot with the wind. When strong winds come, it will protect the crops planted from being destroyed. Heavy rains lift away the good soil. By planting, it helps the reduction of erosion and keeps the land together. Rwanda's Commissioner of Police, Bruce Munyambo, says this is an annual event and it will aid the residents in understanding their role in taking care of the community. With the rain and other complications that may arise, it is important to take care of the environment. The police will help through the process of afforestation as the residents learn as well to take better care of the environment. Seeds were learned to be planted on the bare land so the residents may later reap from the growth. Governor of the Southern Province, Kaitesi Alice, says general laws and regulations should be enacted to protect the environment. The residents of the area approached the police because they saw there was a problem with and needed help rectifying it. They insisted with the issues because of the memory of the beautiful forestation that once stood here. It was a great effort from them and showed how willing they are to correct the situation. There are people on the side that will check on the area from time to time to make sure it is being corrected. At least 20% of Kamonyi district has been replanted. Another large-scale project is underway in the area aimed at restoring the biodiversity network in Mugina and Nyamiyaga sectors. Traditional forest trees, mixed crops, and other edible fruits are being distributed to the community. Umwali Jade at Kamonyi.
And on behalf of the entire news production team, thank you for your company tonight. Stay well and stay safe. God bless you and keep you on until next time. I'm Gloria Mutesi.